Hi everyone, and welcome to today's webinar. This presentation is being recorded and will run approximately 60 minutes, including question and answer time at the end, and will also be available in the Events Industry Council's Knowledge Hub. All attendees today will receive their CEs approximately 1 week after the webinar. I would like to address a few logistical items. Attendees can listen to the webinar through their computers or by dialing in using the number and passcode provided by the Zoom software. If you have any questions, you do not need to wait until the end of the presentation to submit them. We encourage you to submit your questions using the box seen on your screen. We will address as many questions as we can at the end of the presentation. We are also excited to announce our new closed captioning tool. Select the CC button at the bottom of the screen to access closed captioning in real time. Listed here on this screen is our social media handles that we will welcome you to use today. And now I will turn it over to our moderator, Gary Shermark. Gary?
So much, and for Eric's Global Events, and I'm the point person for our company and our efforts to help fight human trafficking all over the globe. So it's my honor to be able to introduce our presenters today. But I did want to welcome so many people from all over the world. I think we have already 28 countries represented, and we're really thrilled that we are part of Planet IMEX and their Community Day today with this session. And I just have to say, you know, IMEX is doing a great job with their education this week surrounding this event. So we're appreciative of that. And again, on behalf of the Events Industry Council, we're thrilled to welcome Cara Napolitano, who she has her master's in International Human Rights Law from University of Denver. She is also the Research Training Manager for the Laboratory to Combat Human Trafficking. And then we also are thrilled to have with us a great expert in this area, Anjanette A.J. Alejano-Steele, who has her PhD in psychology from Michigan State. She is a co-founder of the Laboratory to Combat Human Trafficking. So, ladies, welcome. We know that this is an important subject, and I'll turn it over to Cara.
Thank you so much, Gary, the Events Industry Council. I just wanted to say for everyone, thank you for joining us during a time of crisis and pandemic. I know that this is a difficult and challenging time for so many. What I wanted to say was just thank you for turning towards this issue of human trafficking instead of away from it, as so many do. We are going to talk about some challenging things today. We're going to talk about sex, immigration, migration, social and systemic inequalities, and how those inequalities and vulnerabilities have been exacerbated by this COVID-19 pandemic. And we're going to talk about how that intersects with your work and what you can do about it. So I'm going to start us off with this video.
Human trafficking is slavery.
And it happens all over America. Any child, any woman, any man could potentially become a victim of human trafficking.
I am a victim of labor trafficking.
I was victim of child sex trafficking, but now I own my body.
Today, I am a mother.
I am an author.
I am a son.
I'm an advocate.
I am an educator.
I'm a sister.
I am a brother.
I'm so much more than what happened to me.
I am strong.
I am brave.
I am outspoken.
I'm compassionate. I am a survivor.
I'm a survivor.
I am a survivor.
I am a survivor.
I am a survivor.
I am a survivor of human trafficking.
So what we're hoping that you can take away from this webinar is a better understanding of human trafficking in general. There are a lot of myths and misconceptions around what human trafficking is. So we're gonna try to get to the root causes and vulnerabilities that can lead to trafficking. We're gonna talk through the intersections of trafficking with your work in the events industry. And then we're going to talk through that increased risk that I mentioned with COVID-19. We'll give you some tools to identify potential victims or high-risk individuals. And then what we really want you to take away today is how important it is for you to take this information that you learned today and bring it back to, wherever you work, and try to get some protocols developed. It's the next step after having a training like this. So I'd like to start with a poll. Derek, if you could put that poll up there. We'd just like to get a better understanding of how many of you have had a human trafficking training. I'm just going to leave this up here just for a few seconds. So have you had a training, and kind of where was that training, or if not, what is your experience with trafficking? Go ahead and answer that as quickly as you can. We don't want to take up too much time with the polls because we only have you for 45 minutes. So just a few more seconds with that poll open. Okay, Derek, you can close that poll and just give us those responses quickly. Thank you so much. So interesting, yeah. So it looks like about 35% of you have had a training, and about 20% of you had a company, and that's amazing. It looks like there's been some Google searching, a few of you who the concept is pretty new, and a few of you who've seen the movie Taken. So thank you so much for that. I really appreciate it. So like I said, we want to make sure that we're all on the same page about what trafficking really is, especially since only 35 of you have had a training before, and try to kind of get rid of some of those myths and misconceptions around trafficking. Many folks believe that all human trafficking is only sex trafficking, so we want to make sure that we're being more inclusive in our definition. As you saw, there are so many different identities and experiences, even from that video. The term human trafficking was first defined in the year 2000. So that was only 20 years ago. But of course, trafficking existed before that, right? Exploitation, human exploitation has been around since the beginning of humans. But we defined the term and created a legal response to the issue of trafficking only 20 years ago. So what we have is a very old crime with a very new response. What we also know is that the majority of folks who are likely to come into contact with a survivor of human trafficking also haven't been trained. So for the fact that 40% of you that have been trained really speaks highly of your industry. But most of our research says that those individuals who are most likely to come into contact with the survivor, healthcare providers, law enforcement, only about 5% of those individuals have had a training. So again, congratulations on being so well trained. But let's talk through what this definition really looks like. So trafficking is a severe form of exploitation for labor, which includes sex as a form of labor through the use of force, fraud, or coercion. Okay, so in this international definition, we include sex as a form of labor, and it's through the use of force, fraud, or coercion. So there has to be an element of force or fraud or coercion or a combination thereof for it to be trafficking. As I'm talking through these different conversations and different scenarios this morning, I want you to be thinking about the vulnerabilities of folks in your community. So we've got 29 or 28 countries represented on this call, and diverse communities around the United States as well. So I want you to be thinking about who are the vulnerable folks in your community, right? Are there, is there economic inequality in your community? What's been exacerbated by the COVID-19 pandemic? Is there an uptick of unemployment? There likely is. Has there been an uptick of racism or xenophobia in the last few years, as there has been in so many countries? Do people of color or queer folks feel safe in your community? Is there work for everyone? And do those workers get paid a livable wage, or are they working multiple jobs or in the informal sector to make up for what they're not getting paid in a livable wage? So be thinking about your communities, your families, and maybe even the places that you've worked as we dive in here. So I want to talk about some different identities. So we've got another poll for you here. Our second polling question is around who is being trafficked. So go ahead and fill that out. Just going to leave that up for a short while here. I want you to tell us who you think is more likely to be trafficked, or who human trafficking mostly affects. Okay, you can go ahead and close that poll, Derek, and give us those results. So we had several people say women and children, and nobody said men, transgender, or people from my country, and then a lot of all of the aboves. And that's right? All of those answers are right. It's that common misconception that it's women and children only that are trafficked. All identities are trafficked. So these are some statistics from the International Labor Organization. In 2017, they estimated that there were around 40 million people being trafficked worldwide. 15 million of those were in forced marriages, and 25 million in labor trafficking, which includes sex trafficking. In that 25 million, we see around 16 million in labor trafficking in the private economy, around 4 million in state-imposed forced labor. So that's cotton fields in Uzbekistan, work camps in Xinjiang, China, for example, and about 5 million in sex trafficking. We see that women and girls accounted for 71%. That's a higher percentage in sex trafficking, and about 50% male, female in labor trafficking. We see a really high percentage, 50% in debt bondage, which means they are indebted and they're working off a debt. Often this is an inherited debt. And it's about 1 in 4 are victims, are child victims of trafficking. So another way to think through this definition is to look at this action means purpose model. So it has to be one thing from each one of these categories for it to be trafficking. So first, there is an action. Often and most commonly, someone is recruited. So someone is deliberately targeted because of a vulnerability that they have. Maybe they are recruited for some form of labor. Potentially they are recruited online. People are recruited from schools, from outside of drug rehabilitation clinics, from group homes, from homeless shelters. Recruitment is one of the most common actions. Someone may be harbored, that is held somewhere against their will, sort of locked up. We don't see that as often as we think. Really, what I want you to be thinking about is the people that you love most in the world and what you might be willing to do for them in order to keep them safe and protected. Most of the time, that leverage that someone has over you of knowing who your loved ones are, or threatening a loved one or a family member, is all it really takes to hold someone in a trafficking situation. And they don't actually need to be harbored. So most of the time people aren't physically locked up. They're coerced or locked up in their minds, right, from leaving. Someone may be transported. That's transported across an international border, across a state border, across town to a motel. But transportation is just one option. People don't have to be transported for it to be trafficking. So people are often trafficked out of their own homes or out of their own neighborhoods. More than 50% of trafficking survivors are trafficked by a family member or someone that they live with. So that transportation myth is just that. It's a little bit of a myth. Someone may be provided, and that's something like, I provide my child to you in exchange for drugs or a place to stay. We've seen an uptick of that action alongside the opioid crisis in the United States, for example. Or somebody could be obtained, and that's that Taken movie that about 10% of you answered that you'd seen. That's kind of snatched off the street and thrown into a bus or into a van or something like that. That does happen. But it is not the common story. Much more likely someone is recruited specifically because of some kind of vulnerability that they have. The means is through force, fraud, or coercion. Okay, so force is that physical force that we mentioned that it doesn't always have to happen. It usually is part of the experience, but not necessarily up front, not necessarily at first. Fraud or coercion is usually used up front and then force comes into the picture later. Fraud looks like promising someone a job doing one thing, and when they get there, it's a different type of job, or they're not getting paid what they were promised, or they're forced to work off a debt that they didn't know that they would have. Coercion is using threats of violence or threats against family members, or maybe even threats of reporting to law enforcement or deportation. These are coercive tools that people can use in order to keep someone, the means by which they keep someone in a trafficking situation. And the purpose is for commercial sex or for labor or services. So at its core, trafficking is about profit. Somebody is profiting off of the labor of somebody else through either commercial sex or labor or services. So it's another common misconception or myth that trafficking is kind of only happening to someone else, people we don't know, someone outside of our community. It's often othered, right? Trafficking survivors aren't people that we know, they're someone from somewhere, some other place. But what I want to make sure that people understand is that trafficking is happening in our own communities, again, to our most vulnerable community members, usually. Anyone can be vulnerable to trafficking, but what we usually see are these push and pull factors that can lead to a trafficking situation. So on the left side of your screen, you see these push factors: abuse or neglect or isolation, homelessness, poverty, debts or lack of access to formal markets, marginalized identity or discrimination. These vulnerabilities that are pushing people to make risky choices. For example, if you're experiencing homelessness, then you have an incredible need, right? You need shelter, you need protection. And if somebody offers you that and you can't find it elsewhere, then even if it seems like a risky promise or a risky situation, you might still say yes in order to get off the street, right? Especially if, say, it's winter or it's in a particularly dangerous place. And so people become prey in these situations because of those needs, right? If somebody's experiencing poverty and they can't find a job for many, many reasons, it could be because they have a felony charge and no one will hire them. It could be because they have no tangible skills or no education. It could be because we've got a COVID crisis and 33 million people in the United States alone are out of work. Someone offers them a job, right? If they are desperate and they need to feed their family, even if it seems like a risky job, they may take it, right, in order to feed their family. So we see these push factors and then these pull factors, these needs that are pulling people into these situations. If someone has a marginalized identity or is facing discrimination and somebody's offering them acceptance, right, it's really human nature to respond to that. So if somebody's transgender in a community that doesn't accept that and somebody offers them that acceptance and that's the first time that they've been accepted in that identity, then of course they're going to start listening and they're going to go hang out with that person and see what they have to say and possibly even take some risks in order to be accepted, right? So what I want to emphasize here is that we see this in all of our communities, these push and pull factors. There's no community that is immune to any of these. And it's really up to us to change how we relate to folks who are experiencing some of these vulnerabilities. So we as a society need to be doing better at offering the things on the right side of the screen to folks, because right now the traffickers are doing it better. The traffickers are winning because they are filling those needs better than our society is in many cases. And that's how people end up being trafficked. So I'd like you to take this third polling question. We want to talk a little bit about different industries where we see trafficking. Derek, so you can put this polling question up, and what this is a list of people who are at risk of trafficking, and we want you to tell us who are in industries that are relevant to the events industry. Choose all that apply. I'm just going to leave this up for about 10 more seconds. So we've got farm workers, meat packers, truck drivers, delivery drivers, sex workers, hotel staff, nail techs. Okay, we can close that. Let's see what everybody said. Right, so I think the highest was hotel staff, which makes sense. You are in the events industry. But everything got a vote, and that's great. The reason why we asked this question is because it's sort of a trick question, really, because it's all of the above. All of these industries intersect with the events industry at some point. ranching, we're producing food that at events. If you for any event, all of these things are right, energy, construction, commercial sex, restaurants. We see all of this affected by trafficking, especially industries that are kind of low wage, high turnover, sometimes operating in rural communities with less resources, high immigrant populations, or young people who are often hired who may not know their rights or have access to their rights. These are all the industries that we see where trafficking persists. And these industries all intersect with your work somewhere along the way. So we want to be thinking about supply chains. And one more thing before I let AJ take over and talk a little bit more about the events industry is this misconception. So we see a lot of hype around human trafficking around the Super Bowl in the United States or other sporting events worldwide. Trafficking does happen at these events, and any event is a gathering of humans. It's a little bit interesting to talk about now since we're in this COVID-19 crisis and we aren't gathering as humans, but when everyone comes together in one place, there is an increase of demand for both sex and for labor. And so when we have an increase in sex or labor, then we can have an uptick. But there's more hype around this because it's easier for people to wrap their heads around. It's a hook. But really trafficking is happening every day where humans are and where there is demand. And there may be an uptick during events, but what we're talking about are these vulnerabilities that can happen on a daily basis. Turn this over to AJ now.
Thank you, Kara. Good morning, good evening, good afternoon, everybody. We appreciate you being here. Let's take a breath. If you want to join me, just to check if everyone is doing okay. We know that learning about this human rights abuse can pull up or trigger past lived experiences, and we're moving through this content quickly. In my section, we are going to note industry efforts underway and where COVID worsens the conditions that Kara just reviewed. By joining this morning, you help to break the stereotype that the industry may be an unwitting partner in the facilitation of both sex and labor trafficking. Your presence today matters tremendously. So when we look at the portfolio of responsibilities that events professionals attend to, you naturally hone in on the needs of your business clients and their guest experiences. And because of this, you already possess many of the skills to identify human trafficking. As you attend to the details of transportation, security, emergency response needs in your itineraries, it is natural to keep laser focus on your guests, and we invite you to widen out your gaze. You have access to venue details that most never pay attention to. So consider the hand-harvested fruits for your displays at your coffee breaks. And as you monitor the event, people who may be part of trafficked sales crews, who may be hoping to grab an apple while nobody's looking. Consider the construction crew assembling booths, moving air walls, and hanging signage to your specifications, and the cleaning staff who come in periodically and as you're packing up. Within this human rights abuse, the forms of violence and our responses are not static. They shift and evolve, and they happen globally. And single trainings alone do not end human trafficking activities. If Kara and I do our job well, you will want to continue to learn. And we have lots of resources that we will provide you as part of our slide deck. Because our global anti-trafficking movement works to prevent cases from happening, provides victim services, prosecutes cases, and works in community-level partnerships. And today, survivor leadership is more prominent and organized than ever. The more we learn about the complexities of the crime, country and local level legal responses also evolve. Kara, please, to the next slide. Among the current issues relative to this industry, business sectors now attend to liability, government contracts, supply chain risk assessment, compliance and auditing, and internal enforcement goals. More businesses are examining their supply chains and contractual clauses where there may be forced labor. And while there has been a history of trafficking cases involving the garment industry, the hospitality industry, agriculture, farming, among others, in early 2020, we are seeing organizing among survivors to consolidate suits. As a result, new regulations to prevent exploitation of workers are being proposed with different results around the globe. And I'll note here that corporate liability and compliance with new laws absolutely warrant their own webinar. And we'll stay on this slide, Kara. So as we pivot to industry responses underway, let's go to the next slide, sorry. Among the sectors that have responded to the call to end exploitation and trafficking over the last 2 decades, the garment, agriculture, restaurant, and sex industries have called attention to worker rights. Within the events industry, individual companies and organizations with wide industry reach have established funds and initiated trainings. Next. Among them, the American Hotel and Lodging Association in the United States is at the ready with training and public awareness toolkits. Next. And the global organization Child Prostitution and Trafficking, or ECPAT, who addresses child sex tourism and trafficking. In this initiative, industry leaders sign on to a code with a commitment to end child trafficking. And at the bottom, you can see the array of global partners in this initiative. Next. Monitoring sites such as the Accountability Hub provide legal mechanisms for individual and corporate accountability for human trafficking, forced labor, and slavery around the world. And today, the Events Industry Council is advancing training efforts to end human trafficking. As industry leaders, by adding labor lenses and updating your knowledge, you advance trailblazing where gaps still remain. The global pivot currently happening is our COVID pandemic. COVID response forces us to look at root causes in the realm of public health. We repeatedly see stories of classism, racism, as Kara mentioned, xenophobia. As anti-trafficking advocates, we pay close attention. And most of us have found ourselves gaining different insights on the concept of restriction, right? By way of enforced quarantine, curfews and lockdowns, travel restrictions, and limitations on economic activities and public life. I will underscore key factors increasing risk for infection and exploitation, drawing from the United Nations University Center for Policy Research and the United Nations Office on Drugs and Crime. And as we think about vulnerable people at risk for being trafficked, let's begin with those marked as essential employees who have the impossible task of balancing fear of death with an equally significant fear of losing employment. We frame that as constrained choice, where there are inherent restrictions in the choices available and the conditions under which the choice is made. So COVID and human trafficking impact one another in 3 primary ways. First, and I'm going to rest on this slide and have you just think about the scenarios as opposed to me sharing with you images. We'll be here for a while. Human trafficking heightens health risks for victims. Trafficking victims are more exposed to contracting the virus. They're less equipped to prevent it. They have less access to adequate health care to ensure their recovery. And let's consider how isolation worsens mental health. Their already constrained movement is restricted further by border closures and travel disruptions to get to health providers. Across the globe, migrant farm workers struggle to understand what COVID means for their safety and their livelihoods. Even if they face a lower risk of deportation, many worry that the close working conditions in fields and packing facilities put them at risk for contracting the virus. In the Gulf, there is serious concern about the risks of infection for migrant workers accommodated in densely packed, often poorly sanitized labor camps. Second, COVID increases risks of being trafficked for 3 reasons. First, global job losses mean that there's an increased supply of workers vulnerable to false promises and exploitation. This likely makes sense to many of us. Many of us have had to make difficult decisions about laying people off during this time. We grapple with their limited options and potentially constrained choices. The International Labor Organization reports that the economic crisis created by COVID may see global unemployment increase by almost 25 million. Dramatic increases in unemployment and reductions in income are happening, especially for low-wage and informal sector workers. People who are already vulnerable find themselves in even more precarious circumstances. And COVID reduces safe access to safe and reliable employment. Migrant work has been disrupted by border closures and other travel restrictions. Countries dependent upon remittances or workers abroad bringing money back home are suffering. In Bangladesh, over 100 factories have lost business as retailers close stores. The apparel industry employs 4 million people in Bangladesh who are now either at risk of losing their jobs or in a situation of vulnerability due to loss of their steady income. Many Tajiks have been affected as Russia has closed its borders. Again, people susceptible to exploitation, more likely to accept risky employment. In Amsterdam, with closures of nightclubs, sex work is pushed underground, making workers increasingly vulnerable to trafficking. Second, employers have stronger incentives and latitude to exploit workers. And that's because exploitation happens in illegal, informal, or unregulated sectors. The capacity of organized crime to hide its operations during this time, and the lack of willingness by victims to report, and then limited law enforcement. In Thailand, the surge in demand for hand sanitizer and masks from medical manufacturers means demand for cheap labor targeting vulnerable migrant workers. And third, with education systems suspended, children are more vulnerable to exploitation. Schools all over the world have shut down, and this will cause economic stress for some parents, leading to constrained choice to send their children to work. In many developing countries, more children are forced on the streets in search of food and income, heightening the risk of infection and exploitation. And as a privileged parent living in the global north, I rarely think about the ways that education provides shelter and food in so many countries, including my own. Additionally, as shifts to education online occur, online predators have also refined and adapted their tools to engage our kids, and kids of all ages, including college students. Third, COVID is disrupting anti-trafficking responses. These disruptions are fragmenting response efforts by government and non-governmental organizations. In Brazil, anti-slavery operations have halted as the government's special mobile enforcement groups are suspended for fear of exposure to the virus. Social systems, justice systems are limiting their services relative to human trafficking. Everything has slowed down in terms of residence permits. Renewals for benefits are delayed at this time. Access restrictions to prisons and immigration detention centers mean that outreach efforts to identify victims have stopped happening. And communications between police jurisdictions collaborating in cases have slowed down. And then finally, funding and public attention is harder to seek. Organizations that provide critical protections are affected as donors understandably shift their priorities to COVID. Next slide. Thanks to organizations who are able to continue to train like we're doing today. And I'm highlighting here, Focus on Labor Exploitation, or FLEX, who is based in the UK, are able to promote best practice responses to labor trafficking during this time, including things like extending sick leave and providing more aggressive disinfection of work areas. And I've just given you a lot. I'm going to pivot back to Kara as we continue.
Thank you, AJ. So how are we going to be able to make these identifications in time in order to be able to report suspicions of trafficking? The most important thing I hope that you can take away is that we just need to adjust what our definition of trafficking is and what a trafficking victim might look like. If we Google trafficking, if we just Google human trafficking, these are the types of images that come up. And while it's true that young females are trafficked for sex, it is certainly not the only thing that we see, right? So if we're only going on Google, and I'm sorry that I'm picking on Google so much right now, then we're really missing it. We're missing so many folks. We're missing child workers. We're missing domestic laborers. We're missing immigrants, and we're missing homeless populations and people working in agriculture, all of these different identities and experiences. So first thing we can do is expand our definition of what trafficking really looks like. And then remember that trafficking survivors are generally not going to ask you for help. It's another common misconception that everyone will be trying their best to escape. Most survivors don't ask for help, and that's because most survivors don't self-identify as a survivor of human trafficking. They, like so many of you and like myself, are kind of caught up in what the Google definition of what trafficking looks like, and they don't see themselves in those identities, right, that are often represented in Hollywood or online. Often there's a language barrier. People are unaware of or unable to access their rights. There may be physical isolation if we're talking about a rural community. There may be stigma and shame in some of the work that they've been doing. There's often fear of retribution from the trafficker, fear of retribution from law enforcement. There's a distrust of systems because these individuals that are experiencing exploitation failed by many of our systems, right? People have misidentified them. People have accused them of committing crimes that they were forced to commit as a result of their trafficking. So there's all of these barriers to sort of self-identification. And so it's up to us. The responsibility kind of falls to us to make an identification, even though someone may not be asking us for help. So what I've got here is a list of some physical, and I'll show you some behavioral cues going forward. We have to keep in mind that there's never one easy definition. There's so many different identities and experiences that I can't really give you a checklist, unfortunately. But what we need to be thinking about is sort of a constellation of experiences. Once we start seeing several red flags or several behavioral cues, that's when our protocol that we hope that you develop should kick in. So we see unexplained injuries or evidence of prolonged infection or time since injury. It may be that someone was injured 3 weeks ago and it looks like they should have received medical care and now the injury is infected or isn't healing properly, and you're wondering why not? Why did they not seek medical care at the time? And it may be because somebody was preventing them from doing so. Malnourishment or generally poor health. We see basic human needs withheld from folks who are experiencing trafficking. So malnutrition, dehydration, exhaustion. Sometimes people are kept up for days at a time. Because if you are kept up for days at a time and you are hungry and dehydrated, you are less likely to run and you are less likely to report. We see repeated motion injuries, cardiovascular and respiratory problems. If people aren't given the proper safety equipment, then they may be inhaling chemicals or getting chemicals on their skin or in their eyes. We see chronic back pain and foot pain because folks are standing for long periods of time without being able to take breaks as they're supposed to. We sometimes see markings like tattoos or branding. Substance misuse is another big one. Often people who are experiencing exploitation may be using substances to numb the pain of their experience, or they may be being forced to use substances in order to, again, stay under somebody's control. If you're misusing substances, you're more likely to do what your trafficker says if they give them to you or if they withhold them from you. Somebody who doesn't know where they are in really any industry, someone who doesn't know the location where they are, that should be a red flag. It doesn't always mean that someone's being trafficked, but it should pique your interest. Why doesn't someone know what state they're in or what country they're in? Why doesn't someone know their own address? Numerous inconsistencies sometimes sound like lying, and sometimes folks are lying. They're lying to protect their trafficker because they've been threatened. If they tell the truth, then the trafficker will hurt them or their families. And often sometimes people are not lying, but have experienced trauma, and so aren't able to remember exactly their experience in a chronological way. And it may sound like a lie, but it is actually an effect of the trauma that they've experienced. Someone who's speaking on behalf of or for someone that won't allow someone to answer questions that you're asking, or that says that they'll translate, that should be a red flag. Somebody should be able to speak for themselves. Why isn't this person making eye contact? Why is someone speaking for them? A youth having relationships with an older unexplained adult, that could be just a family member, or it could be a trafficking situation, right? So again, it's never easy. These are kind of things that should be overlaying on each other in order to create a system of red flags and behavioral cues that you could use to increase your reporting capability. And we're just going to put this last polling question out there for folks, Derek, just to get a better understanding. Great. We're wondering what your next steps may be with this webinar content in order to curb or end human trafficking in your industry. So again, select all that apply. We're wondering what you'll do, what you'll take away from this. Will you talk with your colleagues? Will you ask your manager if there are protocols in place? Maybe write a blog yourself, create awareness materials, pay more attention to people that you may not have been on your list before, people to be paying attention to. Okay, we can just leave that up for a few more seconds. We can close that poll, Derek. I'm going to turn this back over to AJ.
Thank you, Kara. And we know we've covered a lot of information. We will save some time for questions. We see some questions coming into the Q&A bar at the bottom. As we advanced our slide, Kara, we're here to be able to give you a few ideas. As Kara reviewed the behavioral indicators and things to look out for, those are those concrete next steps next time you're managing an event. And what we're noting here are a few of these things that would invite you to continue learning, to continue thinking about how your company, the industry broadly engages. I'd mentioned earlier this toolkit, and as we look at some of these pieces, really, number one is what you're all participating in a basic training, but you have to move on beyond that to starting to move into protocols for your organization. So this is a great toolkit. Next, Kara. And I'm going to pause here so that you can take a picture or take a screenshot as far as looking at, again, an array of response protocols. Trailblazers have gone before you in terms of creating industry relevant protocols for what do you do next as an organization, as a company, once you identify somebody who may be trafficked? Next. We have global hotlines and resources around the world. We're highlighting 3 next, Kara. And as we look at these, again, I will pause. And again, the slides will be available after we're done through the United Nations, through the European Commission, and the United States. Next. When we look at what hotline referrals provide, here is the array of service needs at the ready. So if you are suspicious of trafficking happening at a venue, call a hotline and leave it to experts, leave it to law enforcement to do their job and to be building cases. Next. We invite you to be thinking about ways in which work visas are processed. There's a lot of research that has been done on exploitation through the use of manipulating visas. Next. And if we had more time, we invite you to think about a tailored training that would involve case studies and being able to walk through these scenarios and think about that response. Next. And again, as far as, organizations like ours, and there's several out there, we are here to serve, to provide tailored trainings to cases you come across. We engage and support your continued learning. We think about ways for you as individuals and organizations to remain involved well beyond this webinar, highlighting Kara's recent blog on COVID. And then last slide. Here we are with questions. We'll open this up.
Thanks, AJ and Kara. And just looking at the chat throughout the presentation, it's just, I think you have a group of people here that want to learn more and want to take some actions. So good job there. Let's look at a couple of these questions that have come in. I think you answered the first one that came in about the increase or decrease in human trafficking during COVID-19. Can you maybe give us a little bit more in terms of what the laboratory's doing, during this time? I mean, what kind of things are you doing to help, whether it's a local municipal government have resources, how are you handling it at the laboratory?
I can take that, sure.
Go ahead.
So at the laboratory, one of our main points of contact with survivors is through our hotline. So we run the statewide human trafficking hotline here in Colorado. What we've seen is a decrease in calls from service providers and from community members, and we think that's a result of sort of an totally understandable preoccupation with what's happening with COVID. So people have turned a little bit more inward and aren't necessarily being as perceptive as to what's going on around. And so trafficking survivors are sort of falling through the cracks in that way. But what we have seen is an uptick of survivors calling on their own behalf, which is fantastic. So we've been making an increase in referrals to supportive organizations. A lot of survivors are looking for housing right now. People have lost their incomes, and so there's sort of an increase in crisis calls. Additionally, what we're doing is taking our training online. So that's part of what we're doing right now. Normally we would go out, last year we trained 5,000 healthcare professionals, law enforcement, and child welfare professionals. This year we're doing the same thing, but we're forced to be doing it online, so we're adjusting our protocols there. Yeah, that's what we're doing at the laboratory to combat human trafficking.
Well, and there's a couple questions here of, people interested, how could they actually become a speaker and do, sessions maybe like this in their own communities or, wherever?
We shared a couple of toolkits mentioned earlier, And so there are companies and then there are industry-wide leaders who will enable folks to continue to learn about the issue, learn more about the complexities, and then prep you to be able to talk to your own company or to be doing public speaking. And so because we have an audience from all over the globe, I won't be able to answer for each of these 28 countries, but even doing some Google searching, we have some of these resources that we had on our slides as far as folks who are accustomed to delivering the trainings and training others. Because as you're seeing, the more voices, even if it's informally over lunch, the more voices and the more awareness helps to spread the word and train eyes and ears to be looking in their communities.
So there's a mention here that on ECPAT, and I know that you had a slide, you talked a little bit about the code, and Merit's Global Events is one of the many hospitality companies that have signed the code. Can you just talk a little bit about that? I think there was a question here that why didn't we mention ECPAT as a reference, and
Perfect.
I believe you did, but let's reinforce that.
Yes, Kara, go to the next slide, please, because I was ready for this question. Oops, sorry, it would be our first slide on the at the very end. So just to highlight here, oops, back up one, back up two. We have the code noted here. This is the code of conduct for the protection of children from sexual exploitation in travel and tourism. ECPAT is a global organization, and you're seeing that by signing on to this code, you are agreeing to commit yourselves to implement the following measures. And here's this quick listing. As Gary said, they have done so much partnership within the tourism industry and hospitality broadly. As far as establishing policies, training, looking closely at those contracts, as I had mentioned. So to sign on is that commitment to be looking out particularly for children in the sex industry. I hope that helps, Gary.
They're doing great work, and we appreciate the way they've gotten our community involved. There's a question here, a couple questions on the Trafficking app. Can you kind of describe for this group, because the fact is most of us either work in hotels or have our meetings in hotels, and it's an important tool for people that are traveling.
Kara, did you want to take it or do you want me to?
I'm not super familiar with Trafficking. I heard that you can take a picture of a hotel, and then law enforcement can use those photographs to identify where victims may be in relation to their ads that are posted on online, usually websites for selling sex. That's what I know about it. We don't use it at the laboratory to combat human trafficking, so yeah.
So I use it, and one of the reasons why our company got so involved in this was the fact that David Peckinpah, our president, saw a picture on the news and from a hotel room with someone who was being trafficked with the St. Louis Arch in the background. And, it was taken through Trafficking. So the app, you can go in the App Store and load it. What it allows you to do is to take 3 pictures of the hotel room, and again, be able to post that with the room number. And when they see a picture on one of these sites, like Kara said, and the background, matches something that was taken on Trafficking, they can easily, be able to go and try and intervene, law enforcement. So a very good tool. One question we had here, just about different countries, and is this a big country issue? I know you said that this happens all over the globe, but can you kind of reinforce that? I mean, this could be happening in my neighborhood where I'm sitting here in my office.
It likely is. Trafficking is happening all over the world. I saw that comment. It's highly unlikely that trafficking is not happening in one country and is happening in other countries. I've personally worked in 7 countries in 4 continents. doing anti-trafficking work. I've seen it everywhere in all forms. I've seen it in child soldiers. I've seen children sold in marriage at very young ages against their will. I've seen young people going door to door selling products in the United States. I've seen young people trading sex for a place to stay. It happens in every single country, in every single neighborhood. It's just not what it looks like in the movies. And so we miss it. We really miss it. So yes, it's happening all over.
I had a nice comment here about the Meeting Planners Against Human Trafficking. It's a Canadian initiative. Their website is mpaht.com. So you can check out the good work that they're doing as well. And I know we're probably coming close on time here. So I think maybe what we can do is, AJ and Kara, if you want to give us one last thought. And, I just, on behalf of the Events Industry Council, I can't thank you enough for taking the time to really be here and help educate us on this terrible, terrible thing.
Well, we appreciate your leadership, Gary. Having worked with you now, I think this is our fourth presentation together in various conferences and venues. Your leadership and the ways in which the Events Industry Council is supporting the public awareness, we know this is a start. We know that there are going to be times that the hairs on the back of your neck stand up, and regardless of where you are coming from in this webinar, becoming apprised of resources, hotlines, ways to be able to respond, I think is your first line of homework, building off of the resources that we are providing here. So thank you for keeping your eyes and ears open, asking questions, and trusting in your instincts.
Yeah, thank you so much for the opportunity to speak to so many people from so many different places. Unfortunately, we can't give everyone resources from every country, but we just think it's easy to go online and Google organizations that are doing this work in your community and align with them. I saw questions about how can I volunteer. Again, just go online and see what organizations are doing this work in your community, and I promise you they will accept volunteers. We do at our organization as well if you happen to be in Denver, Colorado. But if not, I'm sure there's an organization that does. So find out what the hotline numbers are in your region. Put them in your cell phone and have them handy. You're not going to carry around a little piece of paper with you everywhere you go, but put those hotline numbers in your cell phone. Download the Trafficking app. Start having these conversations locally, and that's how you can really get involved. Thank you so much.
Thank you, AJ and Kara, and on behalf of the Events Industry Council, we appreciate this opportunity. Thank you to IMEX for having us part of Planet IMEX Community Day, and the slides and recording will be available after the event, so we wish everybody a great day.